Welcome back to Marching Health. I am Dr. Elliott Cleveland, and I'm joined today by our content creator, Tyler Stoneman. He is the section leader for the Clemson Drumline and also marched Palmetto Percussion a couple years back. We are going to go over the common mistakes that drummers make when they are trying to stretch their forearm, wrist, and hands out, and why it comes down to the details to be able to stretch out these muscles properly. So let's take a look at Tyler's forearm. We've tatted him up. We've got the red marker here drawn on over his wrist extensors. Those are the muscles that when he turns his wrist up to play an upstroke on the snare drum, you see those muscles activate. These muscles actually span multiple joints in the forearm. That is the key to stretching them. So these muscles come up above the elbow here, so you have to make sure you are stretching the elbow. They extend down, they cross the wrist joint and actually go into his fingertips. So if he's going to stretch these muscles, he can't just sit here like this and bend his wrist. He's got to straighten out his elbow. He's got to extend the elbow to get this more proximal portion, the portion that's closest to his trunk up here. Then he's got to bend his wrist, which most people do, but they fail to get the last part. You have to curl your fingers up. So you have to stretch those tendons all the way across the back of the hand in order to get the entire portion of the muscle going to your fingertips. So I'm just going to take him through that stretch. He's going to hold this for 30 seconds. If you don't hold it for 30 seconds, you're not doing it long enough to get the full effects. Studies have shown that doing stretches for 10 seconds is not nearly enough time. So do it for 30. That's kind of the magic sweet spot. Do about 3 rounds of those on each side after you have played. So stretching afterwards helps those muscles recover faster. Let's take a look at the front side now. These are his flexors. These attach to what's called the medial portion, the inner portion of his elbow here. Again, exact same thing. You can't stretch the flexors with the elbow bent because that slackens the muscle. You saw that soften up right here. When he stretches out, it tenses this part because we're stretching that part out. Similar concept down here. This muscle, the flexors, extend all the way to this line in the creases of his fingers and to the final line here. So all the way to his fingertips. So you have 2 layers of muscles. One stops here, one goes all the way to the fingertips. You have to make sure that you extend those fingertips 100% backwards. You can't just bend the wrist. You can't stretch this. If you have your fingers curled up, you're not getting the full stretch. Extend those fingertips, get them all the way. Keep the elbow straight, and you guys can see how much tension we are putting on his muscles by going through that. So that is how to properly stretch your forearm muscles for playing matched grip. Those are the common mistakes that drummers make. They tend to only stretch this wrist joint when you have to get above the joint and below the joint all the way to the fingertips. These muscles right here, these two, are responsible for turning his arm in. So bass drummers, this is the 2 muscles that give you the velocity to come in and hit the bass drum. Snare drummers, that downstroke down towards the drum, this is where that power is coming from. You have a muscle crisscrossing right here. It's a diagonal muscle. It's called pronator teres. Down here, it's called pronator quadratus. You don't have to remember those names. Just know that these are the 2 main players to help you have speed towards the drum head as you are playing. So Tyler is going to turn his wrist in. He's going to pronate, is what that motion is called. And you can see how this muscle would contract across the joint here. And you can see this muscle totally disappear as it pulls his 2 arm bones, his ulna and his radius together. He's just going to go through that a couple times. You can see that motion happen. It starts to happen right here. Good. So that is pronation. That is taking the stick towards the head. Now we're going to talk about the opposite, more of the upstroke motion. The motion allowing the stick to rebound off of the head is called supination. That comes from the main players, his bicep coming down right here. His bicep attaches onto his radius, the arm bone on the outside towards the thumb side of his forearm. And then he's got supinator, the muscle on the outside of his elbow right here. So you're going to see him go through those motions. His bicep contracts. You can see it right here. That tendon sticks out. And then you see this part of his forearm get a little bit beefier as he goes through that motion. That's where the burn comes from if you're playing through some fast exercises and you really start to feel it, or if you noticed on really high passages, your bicep getting tense, that's because you are stretching it and contracting it really quickly. So you can see right here's biceps, right here's supinator. Those muscles are activating. Here's pronator teres and pronator quadratus going in and out as he's going through these motions. If we're gonna stretch Tyler's pronator muscles out so that he can get higher heights for 15 inches and get that proper motion from more of his wrist rather than having to include his arm, we're gonna stretch the pronators, the muscles on the inside of his arm here, these muscles, and we're gonna stretch into supination. So we're gonna turn his elbow out slightly into supination. Then we need to extend a little bit, make sure his elbow is extending right up here. Get him as pronated or as supinated as possible to stretch the pronators, and you can see the tension that is getting put across this strip of red right here across where that muscle belly is. If you are trying to get those heights, research has shown that dynamic stretching does even better than static stretching. So rather than just sitting here doing this, which is not a bad thing, it's still gonna help. If he's just trying as he plays to get more motion through his arm here and just trying to get that stick higher, pulling that wrist back, that's gonna help him a little bit more than just sitting there holding it will. If you still have limitations, go ahead and go through that static hold that we just did. Make sure that you are straightening out the elbow though, so that you get that full stretch on the muscle group and supinate. Go ahead and turn that wrist over so you can get that full stretch across there. You can see his nice carrier tan here shows exactly where that drum carrier is sitting. As it puts pressure right here, it's actually causing a hypoxic moment, which means less oxygen is getting to the muscle tissue. When less oxygen is getting there, that muscle has some cramps and doesn't get as much nutrition as it needs. So right here we have the red X. That's called a trigger point, and that's where a lot of people feel that tension in their shoulders from wearing a drum. This spot can radiate pain up and down his neck and into his arm. So I'm gonna have him go through a stretch to stretch that spot back out and help loosen it up after it's tightened up too much. So we're just gonna tilt his head that way. You can see that muscle stretch out as he goes through that. This is help loosening that spot back up, loosening that tight band of tissue. We're gonna hold that for 30 seconds and do 3 rounds of it so that he really has that muscle loosen back up and it helps get some good blood flow back into that. He comes back up, lets that muscle relax, let blood rush in, and helps the healing process for that muscle. Thank you guys.